Fluoroquinolones inhibit which bacterial enzymes required for DNA supercoiling? Speak, porosity rate 100%, DNA gyrase and topoisomerase 4. Remember, quinolone grabs gyrase. Which fluoroquinolone is preferred for Pseudomonas aeruginosa pneumonia? Levofloxacin. Remember, Levo loves Pseudomonas. Fluoroquinolones are contraindicated in children due to risk of which tendon injury? Achilles tendon rupture. Remember, quinolone tears tendon. Ciprofloxacin should not be co-administered with which cation-rich beverage due to chelation? Milk. Remember, cipro and calcium clash. Name the oral anaerobic DNA-damaging drug that causes a metallic taste. Metronidazole. Remember, metro, mouth, metal. Metronidazole with alcohol can precipitate what reaction? Disulfiram-like reaction. Remember, metro plus martini misery. Nitrofurantoin achieves therapeutic levels mainly in which body fluid? Speak, porosity, rate, 100%, urine. Remember, nitro rules in urine. Give one contraindication for nitrofurantoin therapy. Estimated GFR below 30 nL per minute. Remember, low GFR, no nitro. DNA fragmentation by metronidazole requires which redox environment? Speak, anaerobic or low oxygen, and dot point. Remember, metro works minus oxygen. Delafloxacin retains activity in acidic pus due to what structural property? Speak, weak acid nature. The speak. Remember, Della digs acidic abscess. Sulfonamides inhibit folate synthesis by competing with which substrate? Speak, porosity rate, para-aminobenzoic acid, PABA, porosity rate. Remember, sulfa swaps for PABA. Trimethoprim blocks which bacterial enzyme? Dihydrofolate reductase. Remember, tri-stops folate phenyl. Major hematologic toxicity of cotrimoxazole can be prevented with supplementation of which vitamin? Folinic acid, leucovorin. Folinic acid, leucovorin. Folinic acid, leucovorin. Remember, folinic fixes folate fall. Cotrimoxazole is first-line prophylaxis for which opportunistic pneumonia in HIV? Pneumocystis jirovecii pneumonia. Remember, TMP-SMX protects PCP. Stevens-Johnson syndrome is most commonly associated with which sulfonamide antiretroviral adjunct? Speak, porosity rate 100%, sulfamethoxazole. Remember, sulfa sparks skin storm. Isoniazid requires activation by which mycobacterial enzyme? Catalase peroxidase encoded by CAT-G. Remember, INH needs CAT-G key. Main adverse effect of ethambutol monitored by monthly vision test? optic neuritis, causing red-green blindness, prosody. Remember, etham blurs bright colors. Rifampicin induces which hepatic cytochrome affecting warfarin levels? CYP3A4, also CYP2C9. Remember, RIF ramps CYP. Pyrazinamide is active best at which pH range found in macrophage phagosome? Speak, prosody rate 100%, acidic pH around 5.5. Prosody. Remember, PZA performs in acid. An isoniazid risk with isoniazid increases in patients' slow or fast acetylators? Slow acetylators. Remember, slow ACE, slow clear. Bedaquiline targets which component of mycobacterial ATP synthase? Speak, prosody rate 100%, C subunit. Remember, beta quiets ATPC ring. Prosody rate 100%, major cardiac toxicity warranting ECG with bedaquiline therapy. QT prolongation. Remember, beta bends QT. Linezolid used in MDR-TB causes which dose-limiting hematologic toxicity? Speak, prosody rate 100%, myelosuppression, thrombocytopenia. Remember, LZD lowers platelets. Delamanid inhibits synthesis of which mycobacterial cell wall component? Mycolic acid. Remember, Dela deletes mycolic. Clofazimine discoloration seen in skin of TB patients on which regimen? Speak, prosody rate equal 100%, short MDR-TB regimen using clofazimine. Speak. Remember, clofa colors skin. Dapsone may precipitate hemolysis, especially in deficiency of which enzyme? Speak, rate 100%, G6PD. Remember, dapsone, danger, G6PD gap. Speak, prosody rate 100%. Rifampicin single dose with ofloxacin and minoxidil constitutes which WHO strategy? Speak, prosody rate to 100%, ROM therapy for single lesion leprosy. Remember, ROM riddance 1 lesion. Clofazimine exerts anti-inflammatory action helpful in which leper reaction? Type 2 erythema nodosum leprosum. Remember, clofa calms ENL. Thalidomide is teratogenic due to disruption of which embryonic process? Angiogenesis. Remember, thalidomide throttles vessels. First-line MDT duration for multibacillary leprosy is how many months? Speak, 12 months. Remember, MB therapy 1 year. Acyclovir requires phosphorylation by which viral enzyme? Thymidine kinase. Remember, Ocyclo asks TK. Valganciclovir treats CMV retinitis by inhibiting which viral polymerase? Speak, prosody rate 100%, DNA polymerase. Remember, Valgan veto viral DNA. Cidofovir nephrotoxicity can be reduced by pretreatment with which drug? Probenecid. Remember, proben blocks poison. Oseltamivir inhibits which influenza virus enzyme? Neuraminidase. Remember, Ocel stops N-DOR. Baloxavir marboxil targets which viral cap-dependent step? Endonuclease for mRNA cap snatching. Remember, Balox cuts caps. Dolutegravir belongs to which HIV drug class? Speak, prosody rate 100%, integrase strand transfer inhibitors. Remember, Doludox-DNA. Efavirenz should be taken at bedtime to reduce which CNS-related side effect? Vivid dreams and dizziness. Remember, EFAV ends day with dreams. Tenofovir olafenamide has lower risk of which renal toxicity seen with TDF? Proximal renal tubulopathy. Remember, TAF tames tubules. Cephalosporin inhibits which HCV enzyme? SPK and RNA-dependent RNA polymerase. Prosody. Remember, SOFO stops NS5B. Ritonavir boosts other protease inhibitors by inhibiting which cytochrome? CYP3A4. Remember, Rito reigns CYP3A4. Amphotericin B binds to which ergosterol component forming pores? Speak in prosody, ergosterol in fungal membrane, prosody. Remember, Ampho punches ergosterol. Speak a prosody rate 100. Infusion-related rigor of amphotericin is pre-treated with which antipyretic opioid combo? Speak prosody rate 100% to paracetamol plus pecadine. Remember, pethidine chills shake. Fluconazole penetration into CSF makes it first line for which fungal meningitis maintenance? Cryptococcal meningitis consolidation. Remember, fluconazole finds fluid brain. Voriconazole visual hallucinations are dose-dependent due to inhibition of which CYP? CYP2C19. Remember, Vori vexes vision. Echinocandins like caspofungin inhibit synthesis of which cell wall component? Speak, beta-1,3-glucan. Speak. Remember, casp cuts glucan. Terbinafine accumulates in which keratin structure treating onychomycosis? S-piece, nails. Remember, Terbi targets toenails. Grisofulvin induces CYP enzymes and should not be combined with which oral contraceptive component? Ethanyl-stradiol. Remember, Griseo grinds Pel power. Flucytosine converts to 5-fluorouracil within fungal cell by which enzyme? Speak, prosody rate 100%, cytosine deaminase. Remember, Fexite flips to 5U. Posaconazole is prophylaxis of choice in patients with which transplant type? Speak, prosody rate 100%, hematopoietic stem cell transplant with GVHD. Remember, PASA protects post-graft. Liposomal amphotericin lowers nephrotoxicity by altering what? Drug distribution to renal tubule. Remember, lipoampho loves kidneys. Chloroquine accumulates in plasmodium food vacuole, preventing detoxification of what pigment? Speak. Remember, chloro chokes heme. Severe falciparum malaria in pregnancy is treated with IV formulation of which artemisinin derivative? Artesunate. Remember, Arta saves all. Primaquine is radical cure for P. vivax by killing which liver stage? Speak. Prosody rate 100%, hypnozoite. Remember, Prima knocks sleepers. Nefloquine prophylaxis must continue for how many weeks after leaving endemic area? 4 weeks. Remember, Meflo month, more. Quinine adverse event of tinnitus and visual disturbance is called what? Speak, Cracon, be dead. Remember, quinine quirky synchronism. Atovaquone proguanil acts on which mitochondrial electron transport enzyme? A speak, cytochrome BC1 complex. Remember, Atova attacks BC1. G6PD testing is mandatory before giving which 8-aminoquinoline drug? Speak, prosody rate 100%, Primaquine. Speak. Remember, G6PD guards Prima. Artemisinin resistance is linked to mutation in which parasite gene? Kelch13 propeller domain. Remember, Kelch key to Artemis. Doxycycline is used for daily malaria prophylaxis in areas resistant to which 2 drugs? Chloroquine and sulfadoxine pyrimethamine. Remember, Doxy defies CQSP. Lumefantrine is combined with which artemisinin analog in ACT? Artemether. Remember, Lume loves artemether. Speak, prosody rate 100%. Albendazole disrupts parasite structure by binding to which protein? Speak, prosody rate 100%, beta-tubulin. Remember, albin binds tubulin. Ivermectin is drug of choice for which filarial infection causing river blindness? Onchocerciasis. Remember, Iver ends oncho. Speak. Praziquantel increases membrane permeability to which ion in schistosomes? Calcium. Remember, Prazi pumps calcium. Diethyl carbamazine is contraindicated in onchocerciasis due to risk of what reaction? Speak, prosody rate 100%, Mazzotti reaction. Prosody. Remember, DEC drives Mazzotti. Tinidazole single dose treats which intestinal protozoal infection? Speak, candidiasis. Remember, Teeny tains Giardia. Speak, prosody rate 100%. Nitazoxanide inhibits electron transfer in Giardia by blocking which enzyme? Speak, prosody rate 100%. pyruvate ferredoxin oxidoreductase. Remember, NETA negates P4. Pentavalent antimonial sodium stibogluconate is mainly used for which disease? Speak, prosody rate 100%, visceral leishmaniasis. Remember, Stibo stops Kala-Azar. Noltefosine is contraindicated in pregnancy due to what teratogenic class? Remember, miltefo may harm baby. Parental pamoate causes spastic paralysis by persistent activation of which receptors? Speak, prosody rate. Remember, Pyrantel pinches nicotinic. Benznidazole is first line for which protozoal infection endemic in Latin America? Speak, prosody rate 100, Chagas disease, Trypanosoma cruzi. Remember, Benzi battles Chagas. Ganciclovir bone marrow suppression is synergistic with which antiretroviral causing same toxicity? Zidovudine. Remember, GAN plus AZT guts marrow. Rifabutin preferred over rifampicin in HIV/TB due to less induction of metabolism of which class? Protease inhibitors. Remember, rifabutin respects PI. Say, favipiravir broad antiviral acts by inhibiting which polymerase? RNA-dependent RNA polymerase. Remember, Favi foils RDRP. Teicoplanin mechanism resembles vancomycin. Both inhibit synthesis of what bacterial component? Peptidoglycan cell wall. Remember, Teico targets wall. Colistin acts on gram-negative bacteria by disrupting which structure? Outer membrane phospholipids. Remember, colistin cracks coat. Linezolid serotonin syndrome risk is high with concomitant use of which antidepressant group? SSRI. Remember, LZD plus SSRI storm. Tigecycline is avoided in bloodstream infections due to low levels. Its volume of distribution is described as what? In very large, over 7 L per kilogram. NSDOPL. Remember, Tige travels to tissue. Plazoicin retains activity against bacteria resistant to older drugs from which class? Aminoglycosides. Remember, Plazo overcomes old aminos. Fidaxomicin treats recurrent C. difficile by inhibiting which enzyme? Sigma-dependent RNA polymerase. Remember, Fidaxo fixes difficile. Lefamulin is first systemic pleuromutilin approved for which respiratory infection type? Community-acquired bacterial pneumonia. Remember, Lefa lifts lung infection. Cefiderocol is unique siderophore cephalosporin targeting which resistant pathogen group? Carbapenem-resistant gram-negative bacilli. Remember, Kefidur draws iron bugs. Capreomycin ototoxicity resembles which aminoglycoside adverse effect? Vestibular dysfunction. Remember, Caprio causes wobble. Chloramphenicol gray baby syndrome results from lack of which hepatic pathway? Glucuronidation. Remember, baby lacks GLU enzyme. Ceftazidime avibactam blocks beta-lactamase of which class? Speak, prosody rate 100%, Class A and C including KPC. Remember, Avibac arms chazidime. Narapenem vaborbactam adds protection mainly against which carbapenemase? Speak, prosody rate 100%, KPC beta-lactamase, speak. Remember, Weber beats KPC. Polymyxin neurotoxicity manifests early as paresthesia around which body part? Perioral region. Remember, polypins lips. Clindamycin suppresses toxin production in necrotizing fasciitis by which bacteria? Speak. Streptococcus pyogenes, SSP. Remember, Clinda curbs strep toxin. Trimethoprim causes hyperkalemia via blockade of which renal channel? Epithelial sodium channel, ENaC. Remember, tri-tips ENaC. Nitroimidazole resistance in Giardia involves downregulation of which reductase? Speak, prosody rate 100%, pyruvate for redoxin oxidoreductase, prosody. Remember, Giardia drops PFOR. Azithromycin single dose treats which sexually transmitted infection other than chlamydia? Chancroid. Remember, azithromycin chancroid. Echinocandins are fungicidal against Candida but static against which mold? Aspergillus. Remember, Candin cools Asper. Amantadine blocks influenza A uncoding by inhibiting which viral channel? Speak, prosody rate 100%, M2 proton channel. Remember, Amant plugs M2. Cidofovir does not require activation by viral kinase, thus active against TK-negative strains of which virus? Speak, prosody rate 100%, HSV. Remember, Cido kills TK null. Glecaprevir inhibits which HCV enzyme? Inis 3,4-A protease. Remember, Gleca grabs NS3. Speak, prosody rate 100%. Isoniazid neuropathy prevented with supplementation of which vitamin? Pyridoxine vitamin B6. Remember, B6 blocks NH nerves. Raltegravir resistance develops via mutation in which viral gene? Speak, prosody rate 100%, integrase gene. Remember, MALT-E relies on integrase. Lamivudine treats both HIV and which hepatitis virus? SP. HBV. Unquote. Remember, Lami limits HBV. Erythema multiforme major is a rare reaction to which antiviral given for herpes labialis? Acyclovir. Remember, acyclo angry rash. Penicillin allergy alternative for syphilis and pregnancy when desensitization not feasible? Ceftriaxone prosody rate 100%. Remember, Ceftri saves baby. WHO recommends which antibiotic single dose for yaws eradication campaign? Azithromycin, 30 milligrams per kilogram. Remember, zaps yaws.